I have a good friend that ran a transgender conference every year for many, many, many years. And he was telling me the story of the first discussion of the gender affirming care protocol set for youth, how they could block puberty and help teenagers go through the puberty for which they identify, which aligned with their identity, and not have to go through two puberties. And he said that he was shocked because this room full of transgender adults was split about 50-50 in their opinions of this. 50% thought that is amazing. What a great opportunity for these youth. And the other 50% said absolutely not. Should not be doing this because they need to experience the pain we experience. They need to go through a puberty which doesn't align and have that experience and then go through a second puberty. Now, I bring this story up because I was thinking, well, that's interesting. If you spoke to any of these people attending that conference about gender affirming care for kids, it's a 50-50 chance you'll get somebody that supports it and a 50% chance you'll get somebody that doesn't support it. And yet, so many times I hear people say, well, this person's transgender and they agree with me. Or this person is transgender and they believe this thing, as if then it's the truth and it's the fact. Which called into question for me, how do we know who to listen to? How do we know when somebody is sharing with us what is fact? What is opinion? What is personal experience? What is personal perspective? How do we understand and know it? And so that's what I want to talk about today is when we're listening to somebody, many times we give people expertise, especially if they agree with us, then we deem them experts in something based on something like being transgender or being a physician or being a therapist or something like that. Yet somebody being transgender is not enough to say that means they're an expert on everything to do with gender. Just because somebody's a physician doesn't mean they're an expert on everything to do with medicine. Just because somebody's a therapist doesn't mean they are an expert on everything to do with psychology. We need to understand who we're listening to, what information we can gather from them, and what information might be out of their realm. So let's take a look. I want to start out by looking at those deemed experts, such as myself. How do you know if somebody's a physician or a therapist, somebody who is not transgender? How do you know what you might consider or what you might be able to trust from what they say? And the first thing I think is important to understand their experience with the community. So just because somebody's a physician does not mean they know everything about gender affirming care. Let me give you an example of something similar. When I went through medical school, which granted was a while ago, a few decades ago, when I went through medical school, I never once heard anything about autism mentioned. Nothing. Never heard it, didn't learn anything about it all through medical school. And yet, autism is a part of biology. It is a part of biodiversity. At the time that I went through medical school, it was not taught. So even though it is a part of biology, something we're experts in, we're not experts on every aspect of biology. So I would not go out and speak about autism unless I had some other experience, some other perspective, some other education, because I wasn't taught about it. And so I don't find it any different with gender, even though it's an aspect of biology. So I do think we should know some basis, like I now have some baseline knowledge of autism. We have to have some baseline knowledge, but we also have to understand where our expertise lies, where it doesn't. How much learning have we done? So just because somebody is a physician doesn't mean they have learned everything, as that example demonstrates. So that's the first question. How are they educated on gender? Were they educated in their medical training? If so, what kind of education were they given? Are they actively involved? What books have they read? Do they attend conferences? What experts have they been in contact with? What do they know about the data? What do they know about the research? The other question I have for a provider is, what interaction have they had with the community? Have they worked with the community in a gender affirming clinic? Have they had some sort of training? Have they worked in an area with a higher percentage of transgender non binary patients? Have they facilitated support groups such as myself? What is their experience? What have they done? Because I remember when listening about testimony, I think it was in Missouri. I remember hearing that there were a few physicians that testified in support of anti transgender legislation against gender affirming care. And I thought, well, that's interesting. What physician is speaking up against gender affirming care when multiple national medical organizations and international medical organizations support gender affirming care? And when I looked, it was something like a retired anesthesiologist. My first thought was, well, I highly doubt there was any education at the time that person graduated medical school on gender. I highly doubt they had any direct experience with gender affirming care with patients. So the only thing this person had was an MD after their name. And this is what I mean. We have to understand, what is the education? What is the interaction with the community? Just because somebody has an MD or they're a psychologist, they're a PhD, they're a licensed social worker, whatever, it doesn't necessarily mean they have the knowledge and the experience. So we have to know what that education and what that experience is so we understand what perspective they're coming from. The other thing that I do when I hear someone is I listen for the language used. Now, depending on how much knowledge you have on gender inclusive language, and language is always changing too. So, how up to date you are on language will play a role in how much you can use this. But I think a real general rule, if somebody uses a lot of binary language, it tells me that they may not have a great understanding. They may not have done a work. They may be starting to do work, but they haven't completely done it. They're at a more beginning level. So that would tell me not an expert if they're using binary language. Now, I'm not saying people don't make mistakes, but typically those of us that have been doing the work will catch our mistakes and correct them. So if somebody's using a lot of binary language or using binary pronouns, I hear that a lot, he or she, that is an indication this person's probably not an expert in this field. Antiquated terms that are no longer used, like the terms transsexual or female to male or something along those lines, also indicates to me this person's not an expert if they're using antiquated language. And then the third thing I often wonder is, why are they speaking out? Why are what is their goal? Just like when I listen to any speaker, I'm trying to understand, what is their goal in speaking out? What is their objective in speaking about whatever topic they're speaking about? For me, I want to educate people. I want people to understand the biology and the facts about gender. Yes, I'm an MD, and that, as I mentioned, is not enough. I've done a fellowship in gender advocacy. I've attended many conferences. I work within groups looking at healthcare disparities among transgender non binary patients. I have facilitated support groups for families. I have done gender education at conferences. So that is my background. And I have spoken in some of the podcasts that I do have loved ones, and I've helped some of them navigate the healthcare system. So I have that perspective as working the system as an advocate on the patient side of things. And a lot of the families I have worked with, whether facilitating groups or whether my own loved ones, I have worked a lot with youth that transition prior to puberty. So that's really my area of expertise, and that's the perspective I often come from. If you need help on understanding a certain perspective, then you want to find someone. Like, if you need help understanding what is it like Or what are things we need to consider in providing healthcare to those that transition prior to puberty that are adults, then it would be a person like me that could help you, that has that background, that has that experience. So it's important to know, what do you need out of it? What do you need out of what you're listening to? And who is that person? What perspective? What is their background that they are giving you? Now, as I mentioned at the beginning, that conference years ago that first presented the protocol that we have used for a couple of decades now, which I just want to point out is older, is older than some antihypertensive medications, but we've been doing it a long time. And some of these meds, all of these meds are used in various conditions in medicine. But what about somebody who is transgender or non binary? What about their perspective? Those are voices I think are very important to hear. And what you are going to gain from them is their individual experience. Now, they can be an educator as well. So let me talk about that. For somebody who is transgender that is also an educator, it's very similar. You want to understand their perspective. You want to understand, what is their background? What is their knowledge? Where they worked? Have they worked with kids prior to puberty? Have they worked with adults? Have they worked with people going on a fertility journey? What is their perspective? Have they worked with various voices, various people, and who have they worked with? So that you can understand, if you're going to them as an educator and an expert, what perspective they are bringing. And so let me give you an example. I was listening to a podcast the other day, and they had a transgender woman on it who was an expert in politics. And it was very interesting understanding her perspective, understanding her experience. She had a lot of valuable things to say. And there were two things that she said that made me question her perspective and her areas of expertise. The one comment she made is she was very supportive and advocating for gender affirming care for adults, but she specified adults and not minors. And this made me question, one, she's a person that transitioned after puberty, so it's not her own experience. But it made me question, how much has she been involved with those that have transitioned prior to the age of 18? What is her knowledge base there? What is her exposure? What is her experience? What does she understand the data to be? Why does she not agree with multiple medical organizations that have looked at research? What is it that has her go against the standard of care agreed upon by multiple medical organizations like the American Academy of Pediatrics, the American Psychological Association, the American Medical Association, the Endocrine Society, the American College of OBGYN? You get the idea. Why would this person have a different perspective? It made me question how much experience, how much education she has had on that area. The other thing that she mentioned was she commented on a kindergarten teacher who was asking families to share their students' pronouns. She was like, "This is too young. This is ridiculous," something along those lines. And I thought, well, I wonder how much developmental knowledge she has. Because for the most part, and development is a journey, there's not always a numbers, right? There's some variation, but for the most part, kids are able to distinguish that there are some differences between the sexes around the age of 2. And for the most part, most kids begin to understand the difference between the pronoun he and she around the age of about 2.5. Many times, if you've been around kids younger than that, you can sometimes hear as they're learning, they may use he and she indiscriminately. They use them interchangeably. It doesn't matter. And so that often has to be learned, that he goes with someone who identifies as a boy and she goes with someone who identifies as a girl. And they goes with someone who identifies as non-binary, as some examples. So we're teaching it much younger. And I know this for a fact. because, well, not only have I observed it, but my own child had language therapy when he was 3 and he hadn't learned personal pronouns. And they would teach him, he is for a boy, she is for a girl. They were actively teaching him at the age of 3. So personal pronouns are already taught. And all that the kindergarten teacher was doing is tell me how to refer to your child so that I don't make a mistake. So the only message that the kids are getting is that everyone has a pronoun that represents themselves. And the teacher's just asking, which one is yours? Just like they're saying, which name is yours? Which pronoun is yours? There's nothing new here, and there's no new education. There's no new idea being presented. It's all been taught for the majority of kids by this age. The majority of kids have mastered personal pronouns by the age of 5. So, this is an example where the person on the podcast could speak to their own experience, could speak to aspects, but one thing they did not have perspective on is the experience of transgender youth. And so, again, I think it's really important to understand where somebody's coming from. And then there are other people, transgender, non binary voices, that speak up, that are speaking to their own experience. And those are really important to hear. And I encourage you to listen and hear as many as you can to be able to see the great diversity of experience, that there is not one way to be transgender. There's not one way to be non binary. It is important. And as you listen to somebody tell their personal experience, remember that no one person can represent everybody. They can't. They can only represent their own experience. And so it's understanding, where is the person coming from? What is their perspective? What can I gain from this? What is significant to their experience? Listen, take it in. And human nature is to often generalize one person's experience to everybody. And we have to be aware of that to catch it and say, no, this is this person's experience. And I want to hear as many people's experience as possible, because when we listen, when we hear and we understand the great expansiveness, the great diversity of experience, and with that in mind, I think when you're listening to people to say, how much of a depth of perception do they have? Things to listen for are conditional language. Things like, there are some people that have that experience, or I have heard some people share this with me. So they're not using all or nothing language. They're not saying all transgender people fill in the blank, or this never is the experience. Those all or nevers often indicate to me that somebody does not have a great grasp of the diversity of experience that exists. So, when you're listening to people talk about gender, about experience, about perspective, about healthcare around gender, all of those things, in summary, the number one thing is consider that person's perspective. What is their experience? What do they know? What angle are they coming from, so you can understand where their zone of genius is? And being aware that this is one perspective, one zone of genius. Take in multiple zones of genius, but understand where each person is coming from. If the person is talking about something, what is their experience in that subject matter? So, what is the perspective? Is the first question I want you to consider as you listen to somebody speak on gender. The second one is listening for the language. Is it up to date? Now you might say, I don't know if I could judge that. That's okay. Listen, are they using binary language or not? That to me often demonstrates a certain level of expertise or not. It's not fail proof, but if someone's using binary language, they probably do not have a complete knowledge of gender or a higher level of expertise yet. And are they using all or nothing speech? Are they using all or nothing language? Because for me, the minute someone uses all or nothing, there's nothing in biology. There's nothing in life that is all or nothing. So the minute I hear all or nothing language, then it calls me to question how much they understand the diversity of experience that it exists. And so just remember that perspective matters.